You get the same benefits with walking a mile as jogging a mile. It just takes a little longer. It's important to try to vary intensity. You don't have to go extremely high. If you're walking, I even think of picking up the pace, between streetlights, walking a little faster and then slowing it back down a little slower. That variability in the intensity of exercise has been proven to be more effective. I think exercise really stresses every system in the body, in a positive way. It reduces the risk of virtually every chronic disease. And I think there's tremendous pressure from the pharmaceutical industry for us to focus entirely on pills. We tend to really overpromise and underdeliver when it comes to pills and procedures and healthcare. Getting involved in some resistance training, particularly as we age, we see pretty dramatic losses in lean muscle mass, particularly in women, that can have a profound effect on their quality of life, their ability to do the typical activities of daily living that they want to do. So I think throwing in a resistance exercises, often just body weight exercises, push-ups, planks, sit-ups, those kind of things are very important. I have exercise data on all my patients, and we were able to follow them along on how did people who exercise do with COVID versus those who didn't exercise. And what we showed is those who were
Hey there, welcome to the Happy Habit Podcast. I'm Matthew. You'll find me in this place every Monday and Thursday talking to experts on health, well-being and self-improvement. If that's your thing, you're in the right place. And if you're getting value from any of the episodes on this podcast, please show your support. All I ask is that you do one thing, and that is hit the subscribe button. It makes such a difference. And we've seen a huge increase in subscribers in recent weeks. Amazing. And if you're feeling super generous, share news of this podcast with other people in your life who you think might get value from these episodes too. Now, today I'm speaking with Dr. Robert Sallis. He is a former president of the American College of Sports Medicine and currently chairs Exercise is Medicine, which is a joint initiative of the ACSM and the American Medical Association. He's also a great advocate of the health benefits gained through physical activity, and he is currently a physician practicing at Kaiser Permanente in California. I asked Dr. Sallis how exactly exercise can be deemed to be a form of medicine. We hear how often you should exercise and what kinds of exercise are most beneficial. Discover just how impactful something as basic as walking can be physically and mentally. Plus, we explore just how quickly you can see changes in your body when you start to walk or indeed engage in any form of exercise. This is a great conversation. I hope you enjoy. The average person in this day and age spends a minimum of 5 hours sedentary every single day. We are experiencing, as you will know, record levels of obesity, diabetes, hypertension, chronic disease, the whole lot. In this context, broadly speaking, can you explain how exercise can be medicine?
Yeah, I think exercise really stresses every system in the body, in a positive way. It reduces the risk of virtually every chronic disease. And I think it should be the first line prescription. And if you look at any of the guidelines for treating everything from heart disease to diabetes to depression, the first guideline typically is get people more active, get them to do regular exercise. And unfortunately, in healthcare, we tend to skip right over that first set of guidelines, the lifestyle changes, and go right to the first medication. And I think there's tremendous pressure from the pharmaceutical industry for us to focus entirely on pills and sort of ignore the beneficial effects of exercise and other lifestyle changes.
The CDC produced a report all of 25 years ago now that laid out the main contributors to our overall health status, and our behaviours accounted for 50%. Our genetics accounted for 20%, our environment another 20%, and only 10% was influenced by access to medical care. So our health really is literally in our own hands and in our own behaviours.
The bulk of it, for sure. And I see this day in and day out. I continue to be underwhelmed with the benefits of pharmaceutical products. Like, really, that's all the better you are on that antidepressant, or even this surgery, and this is all the better you are. I'm always underwhelmed. We tend to really overpromise and underdeliver when it comes to pills and procedures and healthcare. There's a lot of hoopla, a lot of hype around what we do with medications and procedures. And I see it day in and day out. Wow, that's all the better that patient is after what they've gone through, or the expensive medication they're taking that causes lots of other side effects. Um, I think it's high time that we start going back to the basics, and what makes a person healthy and live a long time.
Our behaviors, it comprises of three things you've said in the past: minutes of exercise per week, whether you smoke or not, which is a huge factor, and your diet. So could you just go into a little bit more detail on those?
I think that, we've done a great job with smoking. You could start right there. I mean, I don't think there's anybody around the world over about the age of 5 that hasn't heard that smoking is hazardous to your health. And we have seen smoking rates decline, certainly, and healthcare was a part of that. But I think more it was when we sort of stigmatized smoking, that it wasn't the cool thing to do, and we made it harder for patients to smoke. That's when we really started to see change. The medical community added to that with doctors recommending to stop smoking. You shouldn't smoke. And then, of course, once we had pharmaceutical products, it really ramped up when we spent all this money on Nicorette gum, nicotine gum. And really, that didn't change things much. It more came down to when a person decided for themselves, not so much whether they had a medication to try to help them quit smoking. But I think that's been a success story. The diet piece is really, for me, hard to get my hands around in a 5 minutes of my office visit where I have a few things to say about what lifestyle. Certainly, I think the most important message is you need to find a diet that helps you maintain a healthy weight. And, we can argue all day about what's the most effective diet. And I think it really varies depending on the person. And certainly there's so many things that play into diet, from your own taste to social, part of your social milieu, your culture, has tremendous influences on what you're going to eat. And I really struggle with how to get patients to change and what to tell them to change to when it comes to diet. But whatever it is that keeps you in a healthy weight range. The exercise piece, the beauty of it is that nobody argues. You can look at physical activity guidelines, in China, compared to Europe, Australia. We all say the same thing: 30 minutes, 5 days a week, moderate to vigorous exercise. Nobody argues about that. You try to get 5 experts to agree on what to say about diet. You've got so many disparate recommendations from so-called experts in the nutrition industry. It's hard for me to make heads or tails of it and what to tell a patient in an office visit. But with exercise, it's crystal clear. There's no argument. The dose is the same. The recommendations are the same around the world. So there's universal agreement, which is pretty unusual in healthcare, that this is the most effective treatment. Here's the dosage of this medication. And we've got proven benefit in, 100 years of plus years of studies, really going back to Hippocrates, when he said eating alone will not keep a man well. He's got to take food or when, the exact quote, but basically food and exercise are critical to health. He was one of the first to say that. So how do we keep forgetting these messages?
When it comes to exercise, you are particularly in favor of walking as a form of exercise. What is it about walking that appeals to you? Is it its simplicity, its universality? Is it something that literally almost anybody can do?
Yeah, all of those things. It's the most studied form of exercise, the most studied formulation of the exercise medicine that we have. It's very easy to measure. I love that. You can walk for time, 30 minutes, 5 days a week. You can walk for distance. We want to try to get in about 5 miles a day. You can measure steps, 8 to 10,000 steps is the reasonable range to target. So I love that it's so easy to measure. It's easily accessible. You can do it anywhere. And it's very social. If you walk with other people or walk with your dog, I think those kind of things, those kind of hooks help people keep doing it and keep repeating that behavior when you make it more social. I think we have tended, one of the disappointing things with exercise is, we have a lot of gyms where people just go in and put on headphones, walk on a treadmill. They really don't enjoy it. We've taken the social aspect out of exercise. And I think that's something that really needs to change to get people engaged, is making it more social. And walking has the potential to do that if you walk with others or a pet.
What's happening physiologically in the body whenever we engage in walking 30 minutes a day, every day of the week?
Well, we certainly know that as we get the muscles moving, we burn more calories. We ramp up sort of the endocrine system as we build muscle. It burns glucose. There's a whole host of factors we don't really know why it improves. Virtually every organ system improves, and every chronic disease, both primarily preventing it and secondarily preventing it. Once you have diabetes, for instance, or cancer, your risk of dying from it or having a recurrence in cancer are dramatically lowered people that exercise. I don't know if we know the exact mechanism why it works on so many organ systems. I mean, it's really a poly pill, and we tend to forget when we look at the effect of exercise, say on depression, that also it's helping the depression almost comparable, really comparable to most of the medicines we use, but it's also helping the diabetes and the heart disease. And Prozac does nothing for diabetes, does nothing for heart disease. So we tend to lose sight of, as we compare it with medications in just one disease, that it's also affecting all of these other diseases. We know that people with one chronic disease often have two or more chronic disease. There's a high rate of having multiple chronic diseases, along with mental health issues that exercise is so powerful to affect. And clearly, we know that brain health is dramatically improved, probably mediated by BDNF, the brain-derived neurotropic factor, that almost acts as a miracle grow to the brain. We know that it can delay the onset of dementia. And I think it's the best treatment we have. That to me really is the most powerful effect of exercise. I think at the end of the day, as the data has come out in the last 10 to 15 years, its effect on the brain is probably its most powerful benefit.
I've heard you say too that walking can strengthen the heart and lungs. This is extraordinary considering we walk everywhere, but you would think something as low impact as walking wouldn't be so transformative to vital organs like the heart and lungs, but that seems to be the case.
We know certainly that ramping up intensity gives more benefit, but when you ramp up intensity, you're generally going to do it a shorter time. For the most part, you get the same benefits with walking a mile as jogging a mile. It just takes a little longer. You burn roughly the same amount of calories, maybe a little bit more with the running, but it's not dramatic. And so I think that it's whatever you enjoy. If you enjoy ramping up that intensity, and I think the best thing is to vary the intensity. We talk about HIIT training, high intensity interval training, which is a great way to get exercise in a shorter amount of time. And a lot of people like to go at a higher intensity, but some don't. And so I think it comes down to personal preferences. And so if time is an issue and you enjoy the higher intensity, then HIIT training could be the thing for you. We also know that it's important to try to vary intensity. You don't have to go extremely high. If you're walking, I even think of picking up the pace, between streetlights, walking a little faster and then slowing it back down a little slower. That variability in the intensity of exercise has been proven to be more effective. And so I think it's good for people to vary the intensity a little bit. The other thing I think it's important to bring up is the importance of cross training, and the importance of resistance training, adding that to your exercise routine. It's great to walk 30 minutes a day, and that's sort of my minimum bar. I love to try to encourage my patients to do that, but getting involved in some resistance training, particularly as we age, we see pretty dramatic losses in lean muscle mass, particularly in women, that can have a profound effect on their quality of life, their ability to do the typical activities of daily living that they want to do. So I think throwing in resistance exercises, often just body weight exercises, push-ups, planks, sit-ups, those kind of things are very important.
We live in a world obsessed with convenience, and there's seemingly no greater convenience than the car, which is paradoxical given how much time we spend in traffic jams going nowhere fast. But it means that the most basic of activities that we've evolved to engage in, that of walking, has been sidelined. Do you believe that we have undervalued walking, certainly in recent decades since the advent of the car?
Yeah, I think, when I talked about smoking, I talked about the most effective thing that I think we did for it was sort of making it hard for smokers. They had restrictions on smoking. Remember, we used to be able to smoke in airplanes and public places. You can't do that anymore. We made it difficult to be a smoker. And at the same time, we've made it difficult to be a walker. You almost have to drive your car, and people are driving around trying to find the closest space. And I think what we really needs to be done is we need to make it harder to drive and easier to walk, and making cities much more walkable. I think that's is a great way to help improve public health, is by making walking more accessible and easier to do instead of making it more difficult. And you see a lot of great cities around the world that have really pushed to open up the cities to make it, have public transportation available so they can come to the city center on public transportation and walk. And clearly we've seen studies showing that these people who live in cities that are more walkable are healthier because they're forced to walk. It's not so easy to drive your car. And I think that that's a way that government can influence exercise habits and make people walk more to improve, and in turn improve their health by doing so.
Funny, I was in Los Angeles about 20, 25 years ago, and I was only there for several days, but I didn't have a car, so I walked everywhere, and people were looking at me from their cars as I walked down the pathway, or the sidewalk, as you would call it. They just thought it was so unusual, and I felt it was unusual because I didn't meet anybody else walking at the same time.
Yeah, it's very difficult to walk in Los Angeles. There's not great public transportation. You almost have to have a car. There's often great distance between, it's not like a central downtown area, even in the city of within the city of Los Angeles, very difficult to get around without a car. I mean, the public transportation is just not very organized and not easily accessible, and sometimes dangerous in certain areas. It can make it challenging to be active in a city like Los Angeles.
You mentioned the influence of the pharmaceutical industry and pills on the medical field earlier. I know you've been involved in a global campaign to get more doctors to prescribe exercise instead of pills. Can we just revisit this subject in relation to the mindset of doctors? Is there a fear in doctors, do you think, of prescribing something like exercise, which is a kind of an abstract thing, as opposed to handing over a prescription for a pill, which that patient then can go to a dispensary and get and then pop that pill?
My encounters with physicians, we all know, nobody argues about it, that exercise is really important. I can tell them in my office, but how do I get them to do it? I don't really have any support, and I don't have a pharmacist informing them how to do it, or I think I really need an exercise fitness professional to be able to refer my patient who needs resistance training. And obviously walking is something simple I can refer to, but it's how do I get my patient to do that? That's been a difficult nut to crack. And what we've done, my practice is at Kaiser Permanente. When I was president of the American College of Sports Medicine back in 2007, 2008, we kind of conceived of this exercise vital sign, or physical activity vital sign. And we've been doing this at Kaiser going back to 2008. At every visit, patients are asked 2 questions about their exercise on average. How many minutes or how many days a week do you do moderate exercise like a brisk walk? The medical assistant, as they're rooming the patient, taking their blood pressure, measuring their pulse, their weight, their height, so we have their BMI, they ask them those 2 questions about exercise. How many days a week are you doing it? They click 0 through 7. The follow-on question is, on those days, on average, how many minutes do you do physical activity for? And they click 10, 20, 30, 40, so on. The 2 numbers are multiplied together to give minutes per week of self-reported moderate to vigorous physical activity, moderate or greater physical activity. And we call that our exercise vital sign. And it's on every patient. And the hope is that the physician will note it and say, today I notice your blood pressure is up, and you've reported you're not doing any exercise at all, or you're doing, 20 minutes a week. Why don't we have you try to walk 30 minutes a day, maybe cut back on your salt, and let's monitor your blood pressure for a few weeks and see if we can control it without going to a medication. That's the whole idea. Before I put you on insulin for your diabetes, or I start you on Prozac for your depression, let's try first walking 30 minutes a day and see if we can't improve your symptoms or your numbers before we go to a medication. Simple as that is what we're trying to do. And I think there's been really good acceptance, and we've seen inroads of improvements in using this exercise vital sign. But at the end of the day, we're just taking a little chunk of the fitness goal. We don't have resistance training. We don't have flexibility, strength training. Those need to be in there as well. And I'd like to be able to refer to a fitness professional. The other thing we see is that people who have, pretty severe chronic diseases, the most notable to me is breast cancer. We know that women who exercise, they're much less likely probably decrease their chance of getting diagnosed by 50% if they're regular exercises, and helping them survive their breast cancer once they're diagnosed, the secondary prevention of preventing them from dying from it or having a recurrence are dramatically improved in those who do regular exercise as well. And I think really targeting high-risk patients like breast cancer patients, heart disease patients, we've done cardiac rehab for years because we know the worst thing you can do is put a heart patient in bed after they've suffered an MI. We need to get them up and moving early on. We need this sort of approach for multiple diseases, from diabetes to depression to the cancers. I want to be able to refer them to somebody who can take my patient and really monitor them, explain to them exactly what needs to be done, help them get around limitations. Maybe they've got bad knee arthritis and walking is just not going to be the solution. They need to figure out something else they can do based on their limitations. I think that's the future of this, is that I have somebody I can refer to help my patients get more active when they have challenges to doing so.
But are doctors open to that? You said that patients are accepting of this strategy, but are doctors?
But I truly believe they are. They don't have that person to refer to. And it's tough for them in an office visit other than say, go walk, which is fine, but I need something more. And particularly in these high risk patients, I think it's a worthwhile investment to really push them to get more active. I think it will do a lot more for their health than putting them on a lot of the pills we use. Comparing some of the chemotherapies to survival of breast cancer, exercise beats them hands down. And we just got to get the oncologists and a system set up where oncologists can refer to somebody to help achieve that goal of getting patients more active.
Do we know if women and men benefit equally from adhering to a routine of regular exercise?
Yeah, absolutely. I don't think there's any real significant difference. Women, men, ethnic groups, demographics, income, things like that. They're all affected equally. We showed this, in some studies we did during the COVID pandemic. Because we have that exercise vital sign at Kaiser, I have exercise data on all my patients, and we were able to follow them along on how did people who exercised do with COVID versus those who didn't exercise. And what we showed is those who were engaged in regular exercise before they got COVID had dramatically better outcomes. In fact, they were 2.5 times, a person who was meeting the exercise guidelines of 150 minutes of moderate or greater exercise per week was 2.5 times less likely to die from COVID if they were doing regular exercise compared to the person who was sedentary. And then we did subsequent studies to look at different ethnic groups, men versus women, socioeconomic groups. The results were consistently the same. Those who did regular exercise were less likely to die from COVID, less likely to get admitted to the hospital or have severe COVID, like where they were admitted to the intensive care unit, all dramatically lower. Subsequent studies also showed us that those who were regular exercisers were less likely to get COVID than those who didn't exercise. So it was just a window into just one disease. We see it with virtually every disease. The outcomes are much better in those who exercise. And I think this messaging needs to get out to patients. It took the CDC a year to put physical inactivity as a risk factor for severe COVID. Even though these studies came out, I think we hurt a lot of patients by not publishing that data. It was a free medication that could help prevent severe COVID. Why were you not pushing that as hard as the vaccine? It didn't make sense.
I want to give the audience a sense of how transformative exercise and something as basic as walking it can be. How quickly can people see the benefits if they engage in a regular routine of exercise?
I think within minutes, really. I think if you ask a lot of people, I get a sort of a rush of endorphins, where I actually, when I finish it, I feel better. I feel more energetic, within days or so, we see improvements in mood. I'm always blown away by how quickly somebody gets on an exercise routine, they start feeling better. That depression, the anxiety is lessened. And then the longer term effects, of lowering blood sugar, lowering blood pressure, and their effects eventually on health outcomes. Really it starts within minutes, but then within, weeks to months, we see improvements in VO2 max and exercise capacity, and things just get better on all fronts. And again, with virtually every chronic disease, the numbers improve, within a month or so.
Would you recommend people investing in smart devices like a Fitbit or a pedometer, even just to track their progress?
For a lot of people, that's helpful. I don't think it's mandatory. I like it. I carry my iPhone with me, through the day, and I constantly look. At the end of the day, I look at my step counter, and if I haven't hit that 10,000 mark, it often encourages me to get out and go for a walk, after dinner to get me up to 10,000 steps. So I think it can help hold you accountable and remind you where you are if you're meeting these goals. But I don't think by any means you have to have that. But I find it helpful, and I think a lot of people do as well.
Well, there you have it. Exercise, movement, it's medicine that is 100% free, and you won't regret any exercise routine. I can say that from experience. Dr. Robert Sallis, thank you so much for joining me on the podcast today. Really enjoyed our conversation. Well, thank you for tuning into this episode of the Happy Habit Podcast. If you liked it, if you got any value at all, and you haven't so far, please click that subscribe button. You can drop a comment and click that bell notification for any future videos. And if you feel the urge and you see value in these episodes, show your support by sharing news of this podcast with other people. Until next time, stay happy.